Hi, my name is Ashley Thurn, and this is my video recording for substance use prevention and for our final project of examining our prevention program plan that we made. For this final project, I examined a prevention program focused toward women who are struggling with addiction or substance use due to the several challenges and the different obstacles that they face, such as childcare and finances. I examined the things that I would do differently as well as the things that I thought would work. First, I noticed that I do have a large amount of goals for the program listed, such as meeting mental health needs, meeting primary doctor needs, child care, psychiatric help, and also trying to help women gain access to insurance if they do not already have that. Many target prevention programs want to incorporate as much as possible, but it may not be realistic in a non-for-profit prevention program. With the advice of Dr. Livingston, I would have to reach out and partner with another agency for sure to make sure that I would be able to cover all of the bases that I want to be able to cover. This would give my program more stability and more of an opportunity to really expand and reach the entire population that I am aiming for. Next, I think that finances would have to be examined a little bit more closely than I examined them in our relapse prevention program proposal. Non-for-profit companies are often not able to pay their employees very high wages, which could defer potential employees from coming out and interviewing and wanting to work for our company. If we partnered with a company or an agency that has already been successful and is already established, then it might be easier to attract employees, to attract doctors or psychiatric staff, things of that nature. I also looked at the concept of time management and organization. In order to incorporate all of the program pieces such as education, childcare, healthcare, and help for insurances, it will be important to manage time effectively. Scheduling clients for all of these services, if they desire to participate in them, will be a complicated and time-consuming process that will need the assistance of administrative staff. I did not make it very clear in my proposal how I will go about the scheduling, but my plan would be to hire a couple of administrative assistants to handle the scheduling, answering the phones, faxes, things of that nature. By doing this, there will be designated positions responsible for handling all the appointment scheduling and making sure that all of those things are in order. In my proposal, I touched upon transportation as a barrier for women who live in the city of Buffalo. Unfortunately, this is still very true, and many women will have to take the bus in order to make their appointments. They also will probably have to bring their children along if they cannot find someone to watch their children while they are coming to their appointments or going to their sessions. For women who need it, I want to make child care available for them during their appointments, as I had stated in my proposal. I want to have a daycare center at our facility, and I would hire multiple people to manage and watch over the children. Unfortunately, that's going to require finances. It's going to require us purchasing things such as coloring books, TVs, toys, things of that nature. However, I do think this is a really important part for our program because without it, women still may not be able to come out and get the help that they really do need. Overall, I feel like I've developed a complex but important prevention program which could help women in their addictions, depending upon their, of course, involvement in the program, compliance, things of that nature. I do think that my planning to incorporate mental health and psychiatric help is very important because, as we've talked about throughout the course, mental health and substance abuse are often tied together, and help in one area but help in the other may not benefit our clients. Normally, in the agency that I work at, what happens is the client will come in and needs to get stable in substance abuse treatment before they are transferred or before they start in mental health, just because when multiple substances are being used, the clients may not really have a handle on their actual mental health problems. It could just be issues that are being exaggerated or brought about by substance use that may not be issues that are really there once they're clean and sober. Thank you.